You just left a busy restaurant, but instead of feeling great, you're just exhausted and you feel kind of lonely. You heard everything and everyone, but you didn't understand the conversation. So you went and got a hearing test and it came back normal. And now you're starting to wonder, maybe you're just making it all up. Well, you're not, and it's not in your head. I'm Dr. Layne Garrett, founder of Timpanogos Hearing Tinnitus here in Utah. And in this video, I'm going to break down this hidden epidemic that doctors are only now starting to get their heads around: long COVID's silent attack on your hearing. If that feeling I just described sounds familiar, you are so far from alone. Millions of people who've had COVID are now dealing with a whole grab bag of bizarre and frustrating symptoms. While we were all focused on lungs and losing our sense of smell, a sneakier symptom was on the rise, one that messes with our ability to connect with each other. We're talking about hearing problems, but not always in the way you'd think. The most obvious issues are tinnitus, that constant ringing, buzzing, or hissing in your ears, and just good old-fashioned hearing loss. The link between long COVID and tinnitus is alarmingly strong. While the numbers can vary, some studies show a big chunk of long COVID patients report getting tinnitus after their infection. One survey found that almost 28% of people who've had COVID said they developed tinnitus afterwards. Another study noted that tinnitus is one of the most common ear-related symptoms people reported after having a COVID infection. But it's not just about the ringing. There's something trickier going on that's causing a ton of confusion. It's that weird phenomenon when you can hear sounds just fine, but you can't make sense of them. And especially that gets bad when there's background noise. You might know it as brain fog. A growing pile of evidence suggests it's tied to something called auditory processing disorder, or APD. This is the real hidden crisis. You can ace that hearing test. The chart says your hearing is perfect, but the second you walk into a coffee shop or a family dinner, the world just turns into a wall of noise that you can't understand. And here's the part that will get you really crazy. I'm going to tell you about an experience of somebody that came to our clinic. He's 42 years old and a dad of 3. And after he got COVID, he said something changed. He said he could technically hear everything, but it all sounded jumbled, like everyone was talking underwater. He'd go to birthday parties or work meetings, and he said he left those meetings like he'd run a marathon and he didn't get a slice of cake or a word in edgewise. He finally went in and got a hearing test somewhere else, expecting answers. He sat in the soundproof room, listened for the beeps, pressed the button when he heard them, and he passed with flying colors. The audiologist smiled and said, "Well, your hearing is fine." But Marcus wanted to scream because something wasn't fine. That's when he came to our clinic for a second opinion. Instead of stopping at the standard hearing test, we ran a full hearing assessment, including speech and noise tests and cognitive screenings. That's when we uncovered the real issue: an auditory processing disorder triggered by long COVID. His ears were working, but the connection between his ears and his brain, not so much. We started him on a hearing rehab program, and within weeks, Marcus was already noticing less fatigue and fewer blank moments. And for the first time since his COVID infection, he felt confidence in conversation again. This is what happens when you go beyond the beep test, and Marcus's story, it's far from rare. And another patient of ours, she got COVID early on. A few weeks later, the ringing started. She had that high-pitched, relentless sound like an old TV left on in the other room. Her doctor told her it was probably stress, but it never went away. When she came to us, we did more than just listen. We performed a complete tinnitus evaluation and found that she had a slight hearing loss in the extended high-frequency range, something that most clinics don't test, and that was causing her tinnitus. With the right mix of sound therapy and counseling, she's now managing her tinnitus and got her focus back. And she said she's sleeping so much better and feels normal again. So let me say it again, a little bit louder for maybe the people in back. This is not in your head. The problem isn't that you're not trying hard enough. The problem is that you're not even getting the right tests. And honestly, that drives me crazy. People shouldn't have to fight this hard just to be believed that they're having a hard time hearing, just to be taken seriously. If you're going through this, you deserve more than a shrug and a printout saying your hearing is normal. A standard hearing test called a pure tone audiogram is built to do one thing: find the quietest sound that your ears can possibly detect. It's testing step 1 of a 2-part system. But hearing isn't about detection. After your ears pick up the sound, your brain has to take over. It has to filter that sound from all the other noise and translate it into something that actually means something. What we're now realizing is that long COVID doesn't always damage the part of the ear that hears the beeps in the silent room. Instead, it seems to be messing with the delicate wiring between the ear and the brain, the processing system. That's why it's often called hidden hearing loss. One study looked at people who reported hearing problems after COVID and found that even their basic hearing tests were normal, they still reported putting in way more effort in listening. Your brain is working overtime to just keep up, which leads to that crushing exhaustion that so many people call brain fog. You're not just struggling to hear, you're fighting a neurological battle with every conversation. To figure out what you can do, we first have to look at what scientists think is actually going on. It seems that the COVID virus has a three-prong attack planned for your hearing. First, there's the direct assault on the inner ear. The cochlea, deep inside your ear, is full of those tiny little hair cells that turn sound waves into electrical signals for your brain. Research suggests that the virus can infect these cells directly, or it can cause inflammation and tiny blood clots in the blood vessels that feed them. This can cause what is called sensory neural hearing loss, which often hits the higher frequencies and can sometimes happen suddenly. In fact, a major recent study found that a COVID diagnosis was linked to a significantly increased of hearing loss in young adults. Second is neuroinflammation. A COVID infection can kick off a massive inflammatory response that doesn't always shut off when the virus is gone. In long COVID, this inflammation can stick around in the brain and central nervous system. This constant state of inflammation can make nerves hyperexcitable. Think of it as your nervous system's volume knob being stuck on max. This is a leading theory for why so many people get that relentless, maddening tinnitus. The brain is basically making noise out of nothing because its circuits are trapped in high alert mode. The third and most important piece of the puzzle for hidden hearing loss is something called cochlear synaptopathy. Okay, stick with me. This is key. Imagine those little nerve endings in your ears are microphones. The auditory nerve is the cable connecting them to the brain. Cochlear synaptopathy is what happens when the microphones in your ears work just fine, but the tiny connections, the synapses between the microphones and the cable get damaged. Your standard hearing test can only tell you if the microphones are on. It cannot check the connection quality. So in a quiet room, enough of the signal squeaks by for you to hear a beep. But in a noisy restaurant, your brain needs a crystal clear, high-definition signal to tell your friend's voice apart from the clatter of forks and other chatter in the room. When those synapses are damaged, the signal that gets to your brain is weak and full of static. Your brain tries to make up for it by cranking up its own internal volume, but that just makes motor distortion, mental exhaustion, and can even make tinnitus feel worse. If this is resonating with you or someone you care about, take a second to like this video. It helps more people discover the truth about these hidden hearing issues. And if you're into clear, science-backed answers about hearing, tinnitus, and brain health, hit that subscribe button and turn on notifications so you never miss a video. Let's keep pushing for awareness together. Knowing the science is validating, but it doesn't fix the problem. The good news is, while this is new territory, we're not starting from zero. We have tools and strategies to fight back. First step, get the right diagnosis. If this sounds like you, don't stop at the standard hearing test. Be your own advocate. Make sure you're working with a hearing care provider who goes beyond the basic hearing test. Specifically, you want to ask for tympanometry, otoacoustic emissions, extended high-frequency testing, and a speech and noise test to measure exactly how well you understand words when there's background noise to find the exact problem that hidden hearing loss creates. Bonus points if the audiologist also performs a quick cognitive screening to get a glimpse of your executive function, processing speed, and memory. Altogether, these tests will give a complete picture of your hearing health from the eardrum all the way up to your brain to uncover any evidence of nerve damage and that synaptopathy we talked about before. Once you have a real diagnosis, you can start exploring ways to manage it, and there's real hope here. Researchers are finding that therapies used for brain injuries and other neurological conditions can make a big difference. For tinnitus, it's usually a multifaceted approach. An audiologist that specializes in tinnitus care will have many scientifically proven treatment options available. They may recommend sound therapy with either hearing aids or ear-level sound generators. They may also recommend cognitive behavioral therapy to help change your relationship with the tinnitus and reducing the anxiety and the stress it causes. And a third option is Lenire, the first FDA-approved tinnitus treatment technology that is based on something called bimodal neuromodulation, which reduces your brain's focus on the tinnitus. Each of these options have been shown to help on their own, but when used together, treatment success really increases dramatically. One recent study published in Nature Communications found that 91% of patients with hearing aids and Lenire experienced a significant reduction in their tinnitus symptoms. While it's true that not every patient sees this kind of relief, 91% is a huge percentage, especially when most medical professionals tell patients with tinnitus that they just have to learn to live with it. For hidden hearing loss, the solutions are also coming from different angles. A new generation of hearing aids and assistive devices can be game changers. Even when your hearing test is normal, modern hearing aids with smart directional microphones and noise reduction technology can help isolate the voice you're trying to hear and turn down the rest, giving your brain a cleaner signal to work with. And beyond technology, there's hearing rehabilitation. Think of it like physical therapy, but for your brain's listening skills. An audiologist can lead you through in-person exercises which help, or can provide access to a program like Lace AI, which is an app-based therapy utilizing artificial intelligence that has been shown to improve your memory, your auditory skills, and focus and processing speed. You're essentially helping your brain build new and better pathways to get the job done. Going through this can feel incredibly lonely, but you're now part of a huge, growing community that is finally getting answers. What has your experience been like? Have you been struggling to hear since you had COVID? Have you found anything that helped you? Share your story in the comments below. You're not alone, and your story might just be what someone else needs to hear to feel seen. The path forward is built on three things: validation, advocacy, and hope. We now know this is a real biological condition. It's not in your head, and it's not a personal failing. It's the physical mark left by a viral infection. While there's no simple cure yet, the right diagnostics, modern technology, and targeted therapy offer a clear way to manage your symptoms and take your life back. Research is picking up speed, and with every single study, we're getting one step closer to a future where no one has to suffer through this silent epidemic alone. If this video felt like I was telling your story, please talk with a hearing healthcare professional and push for a deeper look into your hearing. Don't get discouraged if the first person you talk to doesn't have all the answers. To get more real answers about tinnitus and hearing loss, including hidden hearing loss, you can visit our website. Our Learning Center is full of free resources to help you take control back of your hearing. I'll leave a link in the show notes below. If you're here in Utah, I'll also leave a link there where you can make an appointment with one of our hearing and tinnitus specialists. Thanks for joining me today. We'll see you soon.